Let me say good afternoon to everyone. And I'm going to start off, but then I'm going to hand it off to Dr. Maria Lynn Miranda of the Children's Environmental Health Initiative at Rice University, and then who will provide some comments. And then following her, there will be Dr. Lauren Ron, Chief Environmental Science Officer at Houston Health Department, and then Dr. Shah will be following. He's the Executive Director of the Harris County Public Health. And then the final speaker will be Dr. Elena Kraft, who is the Senior Director for Climate and Health at the Environmental Defense Fund. It's good to have great partners to help us learn from how Houstonians dealt with Hurricane Harvey, and it still seems as though it was only yesterday, and how we can respond to their long-term needs and how we can be a stronger region when the next storm comes. We have a sterling coalition today from Rice University, the city, the county health departments, and the Environmental Defense Fund. And you will hear from representatives of each one. The Hurricane Harvey Registry was officially launched in April of 2018 with the objective of establishing a baseline understanding of the environmental health risks from Hurricane Harvey. And this important work is not yet done. But the preliminary results from the survey known as the Hurricane Harvey Registry are fascinating. For instance, we see that 46% of the respondents so far had to leave their homes as a result of the flood, and they were displaced for an average of 20 weeks. And 58% of them stayed with relatives before returning to their homes. We truly are a city of the right family values. Of course, many residents are still displaced, that we know, and the city is working hard to help them return to their homes, repairing homes, reconstructing homes, and that process will be going on for the next 3 to 5 years. For survey respondents who reported having significant headaches in the aftermath, 46% said their home did not flood, and 50% of the people who reported having a running nose in the aftermath also said that their home did not flood. In other words, Harvey was an equal opportunity offender. The preliminary findings also have produced insights into Harvey's effect on mental health in the region. For instance, of those who had to leave their homes because of flood damage, 68% or more said, "I thought about it when I didn't mean to, and I had trouble falling asleep or staying asleep because of pictures of thoughts about it that came into my mind." These findings reinforce my long-standing concern that even though our city has bounced back from Harvey, we still have more healing to do. And I pledge to make the resources of the city's health department and other branches of city government available to act on the findings when the survey is complete. And before I turn it over to Dr. Maria Lynn Miranda of the Children's Environmental Health Initiative at Rice University, I have one more important message. More people need to take the survey so that we can learn from them and learn more about our constituents and those whose dwellings flooded and those whose dwellings did not. The survey is easy to use, and it can be found at harveyregistry.rice.edu. And now let's hear from Dr. Miranda. Dr. Miranda?
So I had the unusual situation of having worked in South Carolina after Hugo, North Carolina after Fran, and New Orleans and the Gulf region after Hurricane Katrina. And living here when Harvey hit, it was really striking to me the extent to which our community responded with courage and compassion and creativity. And that type of a community deserves the very best response from our health departments, from our universities, from our city government. And the conversations that were taking place even as the storm was hitting about how do we ensure that we understand the impact that the storm is going to have and get the right resources in the hands of our fellow community members is what drove the establishment of the Harvey Registry. It's a collaboration, as you can see. Maybe if y'all step that way so people can see the slides just a little bit better, of a whole series of health departments and of county agencies and health departments, as well as the Environmental Defense Fund. And the work is funded by the Cullen Trust for Healthcare, a local foundation, the Environmental Defense Fund, and the National Institutes of Health. So you may be aware that a registry was established right after it was established after 9/11 to track the impact of the towers coming down. But that registry didn't get established until 2 years after 9/11. We were absolutely committed to making sure that we got the registry built, this very complicated back end, up and running well before 2 years after the hurricane. So we were delighted with the help of our friends in the city and the county to get this up and running last year, well before 2 years out from the hurricane. And I'm going to show you the purpose of all of it is to identify and track the long-term both health and housing impacts to better prepare us for future events. And the way that we've built the registry, it can be ported, the technical part of it can be ported to other situations in other places in Texas, to any future events in this region, to any place across the country. It was very important to us to make all of the resources that we were building publicly available. This gives you a map based on the data poll we did on January 2nd, which is the source of all the data in this preliminary report. At that time, we had about 9,800 registrants. At this point, we have, as of today, we had 13,672. But who's counting? Oh, that's right, we are. And you can see we're trying to get as broad of a geographic spread as possible. And what's important to know about the registry is this is telling you some idea of the concentration of all the people who have answered the survey and joined the registry. But what's attached to all of this data is a whole series of environmental data layers. So we have data layers of what areas flooded and which ones didn't, where were there trash piles, where were there industrial plants, which if they got flooded, there may have been things in the floodwater. So there's all this environmental data. What did the air pollution monitoring data said? So it's all connected, as well as with socioeconomic information and where are the schools and what are the boundaries of the schools there. So it's the registry connected to a whole series of data that are housed on the Kinder Institute for Urban Research. The director is here, our urban data platform. I'm not going to go through a lot of the details because you have the reports with the maps and the numbers there. But so far, as of the January 2nd date, you can see here the percentage of the people who responded who had their home flooded. It was very important to us that we get information from people whose home didn't flood so that we could do the comparison. Their homes were damaged, income loss, vehicle damage, et cetera. Here's a map that shows you the percentage of people who had to leave their home. So the darker the color here, the higher the percentage of people who had to leave their home. And of all the people who've responded, about 46% of them left their home, and as Mayor Turner mentioned, the average time they were out of their homes was 20 weeks. Then we have some results in this preliminary report, and we'll be issuing a series of these reports as we get more people registered on comparing people who did not flood and people who did flood, and a series of different health effects, whether it was a runny nose, problems concentrating, skin rash, shortness of breath, headaches, migraines. And what we're in the process of doing right now is sort of deconstructing this a little bit. So if your home flooded and you stayed in your home while the renovation work was going on, what did your health symptoms look like compared to your home flooded, but you did not stay in your home while the renovations work was going on, et cetera, et cetera. And if your home did not flood, but lots of homes around you did flood, does that have an impact on what the health effects are for all of you? Mayor Turner and I are aligned on many things, and one of them is that we absolutely need to get as many people as possible registered. We continue to enroll people in the registry. We will be doing that for the next several years, and we'll continue to update information for the people who are in the registry. We're so grateful to all of the people who have already joined the registry. We're grateful to all of you for anything that you might do to encourage people to join the registry and be part of providing a set of tailored solutions for the people who were affected by the hurricane in one way or another, and providing a set of plans for how we prepare ourselves better in the future for any other kind of event. With that, I'll turn it over to Lauren Rahn from the Houston Health Department.
We know Hurricane Harvey exposed Houstonians to increased air pollution, water pollution, and soil contamination, as well as mold inside their homes, among other threats. But until the Hurricane Harvey Registry, we didn't have data on what people felt and what, if any, health effects they experienced before, during, and after the storm. Now we do. The survey data from Hurricane Harvey was established to gain greater understanding of the health consequences of the storm and personal impacts Houstonians experienced. The Houston Health Department will use the data from the survey to help inform both recovery and future response planning. Survey responses will tell us what people needed at different times, which will inform preparedness, response, and recovery planning. Survey responses will help better identify affected areas and populations so we can tailor future public health interventions. Survey responses will support the understanding of variable impacts on the community. Different groups within the community may be disproportionately affected, such as effects on mothers, babies, children, and families, differing from effects on the elderly, and in consideration of socioeconomic status factors. We will understand different health, housing, job, income-related concerns brought on by the disaster, the effects of displacement from home and community networks, and the adverse health and behavioral consequences, asthma, rashes, signs of respiratory illness, anxiety, headaches, PTSD, substance abuse. The longitudinal nature of the survey will allow us to look at the duration of recovery, which needs take the longest to address. In turn, this will allow us to develop better preparedness, prevention, resilience, and coping strategies to ready for future disasters, so that we can respond more actively to health threats from these extreme flooding events, which will become only more frequent as the globe continues to warm. I'm going to turn over to Dr. Shaw from Harris County Public Health.
Thank you, Lauren. Thank you for having Harris County Public Health here. My name is Dr. Umesh. I'm the Executive Director of Harris County Public Health and the local health authority for Harris County. I'm joined by Mr. Mac McClendon, who's our Director of the Office of Public Health Preparedness and Response at our department. I want to start by thanking the Mayor for inviting us here and hosting this event. This is an extremely important activity. Thank you, Mayor, for your leadership now, but also your leadership during Hurricane Harvey alongside county leadership. We really appreciate all of your efforts. It is also great to be here with colleagues from Rice University, City of Houston Health Department, the Environmental Defense Fund, and other partners who are in the room to really describe the public health importance of what this registry is all about. As you've heard from my colleagues, that there is an incredible amount of work that goes into collecting information from the community, and really the job that we have is to get the word out about the registry so that folks can fill out the information and really give us longitudinal information that allows us to really understand better not just the response and the immediate aftermath of Hurricane Harvey, but certainly the recovery. And the recovery, as we know, is not just that sprint immediately, but it's the long-term recovery which we continue to be in. Judge Lina Hidalgo with Harris County works with and oversees the Office of Emergency Management and Homeland Security at the county, and certainly from the county perspective, we continue to know that recovery is a long journey. We also recognize that as a health department, we have to be in the community because that is where people were impacted. So two things that our health department is doing currently. One is that we have been engaged in these periodic CASPER surveys, which stands for Community Assessment for Public Health Emergency Response, CASPER, where we go door to door, and Mr. McClendon actually leads that effort door to door and knock on doors to really understand better what's happening in the community. Just this past Saturday, we were in the Bear Creek area, one of the harder hit areas, certainly during Hurricane Harvey, to really get some better understanding of what the recovery needs are. In addition to that, we've been doing this since Hurricane Harvey, launching mobile health villages in the community where we can bring a myriad of services that we have to the community, because we we believe that it's important for us to be in the community. So I really want to close by saying that we in public health understand that every emergency has a health component, and it's very important for us in public health to be at the table so that we can really describe the importance of the public health aspect of that. But we also know that emergencies go without notice, right? You don't know when the next one is there. And so this is an opportunity to be thinking not just about emergencies that we've had, but also think about emergencies that potentially will be down the road. And certainly the Hurricane Harvey Registry is something that we at the Health Department at Harris County Public Health really want to make sure that our community, our entirety of the community, helps us fill out. Thank you very much.
Thank you. We know that extreme weather events like Hurricane Harvey are becoming more frequent and are happening with higher intensity. In the past 18 months alone, we've seen 5 major hurricanes make landfall on U.S. soil: Harvey, Irma, Maria, Florence, and Michael, as well as massive wildfires that have been ravaging the West. These weather-related disasters are serious signs that climate change is posing a series of interconnected risks to people's physical and mental health. They destroyed homes, contaminated water, and fouled the air we breathe. In the face of these threats, Houston is leading the way in understanding the long-term effects of extreme weather events on health and housing. The Hurricane Harvey Registry provides insights to health outcomes long after floodwaters have receded. Harvey will not be the last storm to hit Houston. By mining information in the registry, however, we will be better prepared to identify potential health threats and to direct resources where they're needed most. The registry also allows us to be at the forefront of understanding how extreme weather events exacerbated by a warming climate are affecting health. These lessons would not be possible without the infrastructure and data generated through the registry. Above all, though, the registry highlights the fortitude and incredible spirit that Houstonians have demonstrated in the wake of these disasters and during the recovery process. Together, we're building a healthier, more resilient city. Thank you.
Let me just say that the Harvey Registry is very important. We've repeatedly said over and over again that we wanted to build the city stronger, make it more resilient, that we weren't building back, we were building forward. And so a part of that preparedness, that resiliency, building stronger, is mining the information so that we will have the data, so we're going to be in a much better position to be ready for the next storm when it comes. And we know it will come. It's just a matter of time. So I'm going to encourage people, and we've got over 13,000 names currently in the registry. I was just asking Dr. Miranda, is there a number that we are trying to achieve, or is that an ideal number? But we know that there were 135,000 single-family households that were impacted, 200,000 apartment units that were impacted. So a lot of people were impacted as a result of this storm. And people are still recovering. Even as we repair, rebuild homes, okay, people are still recovering. Because there are a lot of people when it rains, and if it keeps raining, they're looking out the window, okay? And then the impact that Harvey had on our children. We certainly don't want to overlook that, because that's significant. So there are a lot of things that we need to know. The information is critically important, and that's why we want to stress, please, if you haven't already provided information to the registry, harveyregistry.rice.edu. harveyregistry.rice.edu. So please encourage people to participate in the registry.